recently had a case that you were going to talk about. We named her Sheila, but she's a real person, and she had early breast cancer, and she had a fairly large tumor plus some lymph node metastasis. And we presented these data to her doctor, and her doctor really pushed hard to get her this abemaciclib, and was able to get it through the drug company in Canada. Now, this is already part of standard care in the United States, as you can imagine, but in Canada, it's a little less developed as far as cancer treatment goes, so to speak. And so her doctor actually really pushed for it and pushed with the tumor group. And now this woman is receiving this drug, prior to her getting metastasis, which is going to make a huge difference in her long-term survival.
Mm-hmm. Yeah. Yeah. It's an excellent point. So many of these, the new drugs, they haven't been around perhaps long enough to have, 5 and 10 year survivals, or, and there's so many new things coming out. So I can understand why, that might not be something that can always be done. Is just think, what happened to these folks 3 and 5 years down the road. And as you say, 6% doesn't seem all that thrilling, but then when you start to see that curve diverge, I think most cancer patients would say they would much rather have a chance of no metastasis and, being cancer-free 3, 5, and 10 years down the road. And obviously this drug looks like it's doing that. And that's for ER positive breast cancer.
Yes, exactly. With high risk features. And, I think you've brought up an excellent point here is, so many of these drugs are relatively new, but, with every study, there's going to be a bunch of other studies doing what we call subgroup analysis, taking a certain subgroup. And also, that it's so important to look at the survival curves. I mean, we had a case just yesterday where a patient, was going to be given, we found data for the patient for immune therapy for their gastric cancer. And, the 12-month survival the average 12-month survival was increased to, I believe, 15 months on average. But when you looked at the long-term survival, adding this drug in the clinical trials resulted, instead of having a 12-month survival, which is what the doctor gave this patient, the average actually had jumped up to 27 months. So you have to look deep at this data. And many doctors just don't do that. They don't have the knowledge to understand how these trials are done, or they just don't have the time, or they just don't have the effort. When I talk about early abemaciclib, most doctors say, oh yeah, that's, a nice, 5, 6, 7%. I go, no, you got to look at the long-term survival curves and see how they deviate. Yeah. And so this is part of what we do, is we make sure, the doctors and the patients actually do understand the data.
Yeah. And that's so important, because if you're asking, you might be showing up at your doctor's asking all the right questions, maybe having watched this video or something like it, and now you're asking for this abemaciclib to go along with your care, and the doctor might say, well, yeah, it's good, but it's not that much better. It's just 5 or 6%. And it is important that you're well educated and you're able to say, yeah, I get that now, but I'm looking at 3, 5 years down the road to not be dealing with metastasis, please.
Exactly.
Because that is the key data.